The military helicopter hit the rooftop pad before its rotors had stopped spinning. The side door slammed open and two medics jumped out carrying a stretcher. But it wasn't a soldier on it. It was a dog. A Belgian Malinois, limp and soaked in blood, muzzle still fitted with a tactical breathing mask. Behind him, a Navy SEAL was being wheeled in on a second stretcher, one hand pressed to his side, the other hanging off the edge, fingers trailing toward the dog like even now, even bleeding out, he couldn't let go. The ER doors burst open. And in the parking lot, a woman in scrubs was walking away, cardboard box under her arm, badge already stripped from her chest. Because 2 hours ago, this hospital had decided she wasn't worth keeping. If this story already has you hooked, follow me to the very end. Hit like, and drop a comment with the city you're watching from. I want to see how far this story has traveled. The box wasn't heavy. That was the part that bothered Mara Voss the most. 7 years. 7 years of doubles, of holidays worked, of patients whose names she'd memorized long after the charts were closed. 7 years of knowing which attending physicians listened and which ones didn't, of learning which medications triggered reactions the system hadn't flagged, of catching things in the margins of care that other people called routine. And all of it fit in a box that she could carry with one arm. She walked through the lobby of Hargrove General without looking at anyone. She'd made that decision in the elevator. Don't look, don't stop, don't let the humiliation stretch any longer than it already had. The automatic doors slid open ahead of her, and the Colorado afternoon hit her like something blunt. Late October, the mountains distant and gray, the air sharp enough to sting the inside of her nose. She crossed the pickup lane, stepped over a painted yellow line, and kept walking toward the staff parking structure. Behind her, the hospital continued. It always continued. She heard the helicopter before she saw it. Not unusual. Hargrove General had a rooftop pad, and trauma calls came through on the hour sometimes. But this sound was different. Lower, more than one. She slowed without fully stopping and tilted her head. 2 helicopters. No. 3. And from the north end of the access road, a convoy of military vehicles was already turning into the service entrance, moving fast, hazards strobing. Black SUVs. A field medical truck with the tailgate half down. 2 armored ambulances with markings she recognized immediately, though she hadn't seen them in 6 years. Mara stood at the edge of the parking structure entrance and watched. The first helicopter landed on the rooftop. The second one was already banking over the building, looking for space. Somebody inside was running. She could hear the shoes on tile through the open lobby doors. And then the radio chatter started bleeding through the gap, broken and urgent. The kind of frequency that turned ER staff into something resembling controlled panic. She should keep walking. She looked down at the box. A travel-size hand lotion she kept in her locker. A photograph from a staff appreciation lunch 3 years ago. A copy of a medication reference guide she'd annotated in the margins because the printed version left out the dosage adjustments for compromised kidney function. She should absolutely keep walking. 3 hours earlier, the morning had started the way bad ones usually did, quietly. Mara had come in at 6 for a standard day shift. Ward 3, general ER intake, nothing scheduled to be complicated. The waiting room had the usual early morning mix, a college kid with a sprained wrist who'd waited until after midnight to decide it needed attention. An elderly woman with chest tightness that turned out to be acid reflux. A man in his 40s who'd driven himself in with a nail through his boot. And his foot, calm as anything, reading a magazine in the waiting area. She triaged them in order. She did vitals, she flagged concerns, she passed charts through the system. Ordinary morning. The problem arrived at 8:14 in the form of a 43-year-old man named Gerald Putt, referred by his GP for a post-surgical follow-up after a routine appendectomy 4 days prior. His charts said recovering well. His discharge notes said send him home with standard instructions if the checkup showed no complications. Mara took his blood pressure twice because the first reading didn't match what a recovering patient should look like. She checked his temperature. She looked at the way he was sitting. Slightly forward, weight shifted to his left, the subtle posture of someone managing discomfort in a specific location. She asked him to take a deeper breath. He did, and something moved in his face just for a second. She flagged the chart as high priority. Dr. Elliot Graves came to the bedside 12 minutes later with the energy of someone who was already behind on 3 other things. Mrs. Voss. He didn't say it unkindly. He just said it the way doctors sometimes said nurse names, like a placeholder word, a way of situating himself before he looked at the chart. His vitals are inconsistent with straightforward post-surgical recovery, Mara said. BP is lower than discharge baseline. He's guarding on the right side, and he's had 2 episodes of low-grade nausea this morning that he mentioned weren't there 2 days ago. Graves looked at the chart. He looked at the patient. He looked at the chart again. The surgical notes are clean, he said. I know what the surgical notes say. A pause. Are you suggesting internal hemorrhage? I'm suggesting we don't send him home until we rule it out. Graves ordered a basic panel, looked at the initial results, and told her the numbers were within acceptable range. Mara said acceptable range for a general adult population didn't account for this patient's pre-surgical baseline, which had been notably higher, making the current reading a relative drop even if it didn't cross the absolute threshold for concern. Graves told her she was overreading the presentation. She said she didn't think she was. He documented that nursing staff had raised a flag and that the clinical assessment did not support escalation, and he moved on. 20 minutes later, Gerald Putt stood up to use the restroom, took 4 steps, and collapsed. The imaging they ran after that found a slow bleed at the surgical site. A small vessel that hadn't been properly sealed had been leaking for days. Not life-threatening yet, but another 12 hours, and it might have been. Graves ordered the corrective procedure. The patient was stabilized, and then, 40 minutes after that, Mara was called into the office of Dr. Soren Whitfield, Chief of Emergency Medicine, and told that she had violated protocol by directly contradicting a physician's clinical assessment without standing orders to escalate. She had stayed very still during that conversation. I was right, she said. Once. Evenly. That's not the point, Whitfield told her. The point is how this department functions. If every nurse second-guesses every physician decision, we have no system. We have chaos. Gerald Putt would have gone home and bled internally. He might have returned to the ER in time, or he might have been fine. We don't know that. We know he collapsed. Whitfield had looked at her for a long moment. He wasn't a cruel man. She'd always thought that about him. That the damage he did was the careful, procedural kind, backed by paperwork and policy, which somehow made it harder to argue against. I'm placing you on administrative suspension pending a formal review, he said. 2 weeks with pay. You'll receive the written notice by end of day. She'd taken her badge off outside his office and clipped it to the front of her uniform instead of putting it in her pocket, because she hadn't trusted herself to do anything that looked like hiding. She'd walked to her locker. She'd packed her box. She'd taken the elevator down. Now she was standing at the edge of the parking structure watching military vehicles pour into the access road, and somewhere in the back of her mind, a part of her that had been asleep for 6 years was very quietly waking up. The field medical truck had its tailgate down. She could see a figure in tactical gear moving quickly between 2 stretchers. The positioning was wrong. The weight distribution, the angle of approach, whoever was directing patient movement in there hadn't accounted for the slope of the access lane. And if they tried to unload both stretchers simultaneously, they were going to create a collision point that would cost them 30 seconds at minimum. 30 seconds, in the situation she used to work, was not a number she was willing to accept. She was walking back toward the hospital before she'd made a conscious decision to do it. A young man in a Navy uniforms, not much past 22, 23, face red from exertion and something that might have been controlled panic, came through the ER doors at a near run and stopped when he saw her. Ma'am. He looked at the box in her arms. He looked at her scrubs. He looked back at the doors. Do you work here? I did this morning, Mara said. He blinked. We have 14 casualties incoming, rotary and ground. The ER called a trauma alert, but I don't think they... He stopped, started again. Ma'am, we need everyone we can get. Mara looked at the box under her arm, the hand lotion, the photograph, the annotated medication guide. She set the box down on a concrete barrier next to the parking structure entrance. The patients didn't suspend me, she said. She walked back through the doors. Inside, the controlled panic she'd expected had already started fraying at the edges. The trauma alert had pulled every available physician and nurse into the ER. but the sheer volume of what was coming through the doors was outpacing the hospital's standard mass casualty protocol. 14 casualties didn't sound like a catastrophic number until you understood that 6 of them required immediate surgical consultation, 3 more had blast-related injuries that didn't present the same way as standard trauma, and the remaining 5 included complex wound patterns from a training accident that had gone wrong in ways the initial radio report hadn't fully described. Mara moved past the intake desk without stopping. A ward clerk started to say something, and she held up one hand, not aggressively, just firmly, and kept moving. She found the triage point in the main trauma bay. 2 attendings, both of whom she knew, were working through patients in arrival order. That was the problem. Arrival order was fine for a standard multi-car accident. For this, it was the wrong algorithm. "Stop," she said. Not loudly, just clearly. Dr. Anya Petrov, trauma attending, technically senior to Mara in every organizational chart that existed, turned around with an expression that could have meant several things. "Voss, you're suspended. I know, but your triage sequence is wrong." Mara moved to the whiteboard. She didn't ask for the marker. She picked it up. "You've got 2 penetrating abdominal injuries in bays 2 and 4 that look stable but won't be. Blast wave exposure causes delayed presentation. Internal structures take time to show damage. They need imaging now, not when they deteriorate. Bay 7 is a burn patient, and burn patients are resource-intensive but survivable. They get moved back. Bay 1 is your immediate. He needs surgical 10 minutes ago." Petrov was silent for exactly 3 seconds. "And how do you know which bay is which?" she asked. "You just walked in. I was watching through the bay window for 90 seconds before I came to the board." Mara set the marker down. "You want to argue with me, or do you want to sort your patients?" It wasn't a comfortable moment. Mara knew that. She wasn't trying to make it comfortable. She was trying to make it functional. Petrov looked at the board. She looked at the bays. She picked up a radio and started issuing redirections. That was how it began. Mara had forgotten, somewhere in the years of ER shifts and medication logs and the 1,000 small domestications of working inside a system, how different this felt. The focused kind of fast, where everything narrowed to what was in front of her and the variables she could actually control. She moved between bays, assessed, redirected. She called out medication interactions that the residents hadn't flagged. She repositioned a patient whose airway was compromising in a way that the monitoring equipment hadn't caught yet because the leads had been placed incorrectly in the rush. She did it without thinking. That was the thing. She'd spent 6 years trying to slow that part of her brain down, trying to fit herself into the pace of civilian emergency medicine, and right now it was running at full speed without her permission. 20 minutes in, she registered something that nobody else in the room had noticed yet. Between Bay 8 and the wall, on a lowered transport stretcher that had been placed there temporarily while the bays were sorted, there was a dog, military working dog. Belgian Malinois. She'd been right about that from the parking lot. The animal was tagged with a field medical bracelet on its left front leg. She recognized the format, the service number, the unit designation printed in a specific typeface that she hadn't seen since she'd left the army. The dog was breathing, but shallowly, and the color in the visible mucous membranes was wrong. Pale. The wrong kind of pale. She crossed to the stretcher, crouched down. The dog didn't react to her approach. That was information. She ran a hand carefully along the animal's left side and found what she was looking for. A shallow but significant contusion pattern that suggested internal impact, possibly spleen, possibly worse. The field dressing on the right foreleg was adequate, but the IV line that had been started was delivering fluids at a rate that wasn't appropriate for the animal's current state of shock. "Who is handling the K9?" she called out. Nobody answered. Nobody had been handling the K9. There'd been no time, no protocol triggered, no one with the training. He'd been placed there and effectively set aside. She straightened and found a second-year resident named Torres, who'd been rotating between bays. "I need you here," Mara said. "This animal is going into compensatory shock. We need a veterinary consult immediately. Hargrove has an on-call vet liaison for military working dogs. It's in the hospital's partnership agreement, page 4 of the mass casualty addendum. Get them on the phone, right now." Torres looked at the dog, looked at Mara. I didn't know we had a... Page 4, Mara said. Go. She turned back to the Malinois. She adjusted the fluid rate herself, working from the animal's approximate weight and the presentation she was seeing, buying time until the veterinary consultant arrived. The dog's eyes opened slightly, dark and exhausted and very far away. I know, she said quietly. Stay with me. She didn't say it for anyone else. She didn't care if anyone heard. She was still crouched there, monitoring the dog's breathing, when she heard the voice from Bay 3. Hoarse, strained, but clearly, unmistakably deliberate. That's Mara Voss, she went still. The SEAL in Bay 3 had managed to push himself to something approaching a seated position, despite the oxygen line and the trauma dressing covering the left half of his torso. He was looking directly at her. His face was the kind of weathered that didn't come from age. He wasn't older than 35. And there was something in his eyes that she recognized without being able to immediately locate the memory. She was with the 75th Support Battalion, he said, loud enough that the hallway quieted around it. Camp Verlaine, 2018 and 2019. Mara stood up slowly. Sergeant Voss ran 3 combat casualty extractions on our unit in a 12-day window, the SEAL continued. His voice was working against the pain. She could hear that, the effort it cost him to keep the words steady. One of those missions, she carried Rex out herself. 400 meters. Under fire. The hallway was very quiet now. Whatever she's telling you to do, he said, do it. And then his eyes found hers directly across the room, and the memory that had been just out of reach came into focus. A night outside a forward operating base, rain, a dog bleeding from a fragmentation wound, and a SEAL who'd refused to be evacuated until she promised his partner was coming too. His name was Declan Rourke. She had not seen him in 6 years. She held his gaze for exactly 1 second. Then she turned back to the room because there were still 12 other patients who needed her, and Rex was still in shock and the work wasn't finished. Torres, she called out, already moving. Where's that veterinary consult? On the line? Torres called back, phone already extended. Dr. Kimura, veterinary liaison. Mara took the phone without breaking stride. Dr. Kimura, Mara Voss, ER nurse at Hargrove General. I have a Belgian Malinois, military working dog, estimated 55 to 60 pounds, presenting with compensatory shock following blunt trauma. Contusion pattern on the left lateral suggests possible splenic involvement. I've adjusted the IV rate to approximately 10 mils per kilo per hour. I need you to confirm that and tell me what else you want me doing before you can get here. A brief pause on the other end. What's your training background? Army combat medic. 6 years. I've worked with MWDs in the field. Another pause, shorter this time. Rate is correct. I want a secondary assessment on the gum color every 4 minutes. If it goes white, you call me immediately and we talk about whether we push fluids harder or pull back. Don't let anyone move him. I'm 20 minutes out. Understood. She handed the phone back to Torres. You're staying with the dog. Every 4 minutes, gum color. You write it down. You don't trust your memory. Yes, ma'am. She was already moving back toward the main trauma bay. Ch-ch-ch. The next 40 minutes were the kind that didn't feel like 40 minutes. They felt like a series of problems, each one replacing the last, with no clear seam between them. Bay 1, the immediate, went to surgery after a combined effort from Mara and Petrov, stabilizing him long enough for the OR team to take over. 2 of the blast wave patients she'd flagged early showed exactly the delayed deterioration she'd predicted. One developed a pneumothorax, the other a bowel perforation. Both were caught before they became catastrophic, because imaging had already been running when the symptoms emerged. She moved, she called, she redirected. At one point, she found herself in a hallway with a 20-year-old Navy corpsman who was sitting on the floor with his back against the wall, hands shaking, not from injury but from something else. The specific kind of stillness that followed adrenaline crashing out of a system that had been running too hot for too long. She crouched next to him. When did you last drink anything? She asked. He looked up. Ma'am? Water? Juice? Anything? He thought about it. Before the flight, she stood, went to the supply cart 6 feet away, came back with a bottle of water and a glucose packet. She handed them to him without comment. You did good work getting those patients in, she said. Now drink that and give yourself 3 minutes. Then I need you back." He opened the water. She left him there and kept moving. She wasn't performing composure. That was something she'd figured out a long time ago. The people who performed composure in a crisis eventually cracked because performance took energy and energy was finite. What she had instead was something more structural, a way of moving through an emergency that treated each problem as solvable until proven otherwise, and didn't spend resources on the ones that weren't solvable yet. She'd learned it in places much worse than this. She was halfway back to the main bay when Dr. Whitfield stepped into the corridor. He was still in his administrative clothes, pressed shirt, no white coat, the kind of dress that marked someone who'd come from a meeting and hadn't had time to change before the trauma alert pulled him down. He looked at the controlled activity around him. He looked at Mara. The silence between them lasted approximately 2 seconds. "You're on administrative suspension," he said. "I know. You shouldn't be. Bay 2 needs a surgical consult in the next 6 minutes, or the patient in it is going to deteriorate past the point where surgery helps," Mara said. "After that, I'll be happy to have this conversation." She walked past him. She felt his presence in the corridor behind her. Not following, just standing there. And she didn't look back. She didn't have the attention to spare for what he was feeling about this. Whatever it was, it could wait. Dr. Kimura arrived 18 minutes after the phone call, moving with the focused efficiency of someone who'd done emergency field work before civilian practice. She went directly to Rex, ran her own assessment, confirmed Mara's fluid adjustment, and added a secondary pain management protocol that stabilized the dog's vitals within the next 10 minutes. "Good call on the splenic contusion," Kimura said, not looking up from the Malinois. "If he'd been left on the original fluid rate another 20 minutes, we'd be in a different conversation." "He's stable? For now, I want imaging to confirm the spleen, but his color is coming back." Kimura finally looked up. "You worked MWDs in the field?" "When there was no one else available." Kimura looked at her for a moment with an expression that Mara couldn't fully read. "There's usually no one else available," she said. It wasn't quite a question. "No," Mara agreed. "There usually isn't." She left Kimura with Rex and went back to work. It was somewhere around the 90-minute mark that she noticed Whitfield had stopped trying to remove her from the floor. She didn't make anything of it. There wasn't time to make anything of it. But she noticed the way the corridor dynamics had shifted, the way the residents and nurses who'd been watching her with uncertainty in the first 20 minutes were now just watching her without the uncertainty, integrating her directions into their workflow the way they would have with any attending on the floor. Dr. Petrov fell into a working rhythm with her that developed without discussion. Petrov was a strong trauma clinician, so Mara had always known that, and once the initial triage conflict had resolved, she found that Petrov didn't need to be right about everything. She needed the patients to be right. That was enough common ground. Declan Rourke had been moved from Bay 3 to a monitored room off the main ER corridor. His injuries were serious but surgical. A fragmentation wound to the left side, 2 broken ribs, a deep laceration on his right arm that had been cleaned and packed. He was stable. He was also apparently refusing sedation. She found that out when a nurse named Garrett came to find her with the expression of someone who'd been arguing with a wall. "The SEAL in room 4 won't accept the sedative," Garrett said. "He says he wants to talk to you first." Mara looked at the clock on the wall. 14 patients had been processed. 2 were in surgery. Rex was stable. The immediate crisis had not passed, but it had been contained. 5 minutes, she said. Fatigued. Declan Rourke looked worse under the room's lighting than he had in the chaos of the trauma bay. The pallor more visible, the extent of the dressing on his left side more apparent. But his eyes were the same as she remembered. Alert, watching. "You don't have to refuse sedation to talk to me," she said, pulling a stool to the bedside. "I know. I wanted to see you standing still for a second." He said it without humor and without sentiment, just as a factual thing. "How's Rex?" "Stable. Veterinary liaison is with him. She confirmed the splenic contusion. Imaging is pending, but his vitals are improving." Something in Rourke's face shifted. Not much, just enough. "He stayed with me the whole flight," he said. "Even after—" He stopped, looked at the ceiling for a moment. "He wouldn't leave my side. They had to carry him onto the stretcher." Mara didn't say anything. She knew when not to. Camp Verlaine, Rourke said after a moment. You remember that night, the overwatch position. I remember. Rex was 2 years old, brand new to deployment. I remember that too. He was quiet for a second. You ever tell anyone you were the one who carried him out? No. Why not? She thought about that. About the box she'd left on the concrete barrier outside the parking structure. About Gerald Putt collapsing on his way to the restroom. About Whitfield's careful, procedural voice explaining to her why being right wasn't the point. Because it didn't change anything about what needed doing next, she said. Rourke looked at her for a long moment. Then he said, The guys in my unit still talk about that extraction. We didn't know your name for 3 months. We just called you the medic. That's accurate. Mara. He said her name the way people sometimes did when they were making a deliberate choice to use it. What happened here today? Before we arrived, she could hear the noise of the ER through the closed door. A monitor somewhere. A radio check. The specific ambient frequency of a medical floor that hadn't stopped moving. Administration disagreed with my clinical assessment, she said. Patient didn't. Rourke's jaw tightened slightly. They suspended you. This morning. And you came back anyway. The patients didn't suspend me. She'd already said it once today. It still felt like the only accurate thing. Rourke closed his eyes. For a moment she thought the pain medication was pulling him under despite the refused sedative, but then he spoke again. When I woke up on that helicopter, he said, and Rex was next to me, and I could see he was still breathing, I thought about you. I don't know why. He stopped again. I thought, whoever gets us where we're going, I hope they're half as good as she was. Mara stood up. She straightened the IV line on his arm by habit. It had been slightly kinked against the bed rail. Accept the sedative, she said. Your body needs to stop working so hard. Is that an order? It's a strong recommendation from someone who just spent 90 minutes keeping your unit alive. The corner of his mouth moved. Not quite a smile. Close enough. She was at the door when he spoke again. Mara. She stopped. Whatever they took from you this morning, Rourke said, they don't get to keep it. She didn't answer that. She opened the door and stepped back into the corridor, where there were still patients, still problems, still work that needed doing. But something in her chest had shifted slightly, the way weight redistributes when you've been carrying something for a long time and someone finally acknowledges that you're carrying it. She walked back to the main bay. Whitfield was standing at the nurse's station. He was looking at the tracking board, the one that showed patient status, triage flags, intervention timelines. The board that, 90 minutes ago, had been a controlled mess and was now, line by line, showing a different picture. He turned when he heard her approach. His expression had changed since the corridor conversation. Something in the careful administrative composure had come loose at the edges, and underneath it was something she hadn't expected to see on his face. It looked, if she was reading it correctly, like the beginning of something he didn't yet know how to say. She didn't wait for him to find the words. Bay 9 needs a consult on the wound repacking, she said. The dressing was done in the field and it needs reassessment. I'd do it myself, but I need to check back with Dr. Kimura on Rex's imaging results. She moved past him. In the hallway behind her, she heard him pick up the radio. She heard him issue the consult order for Bay 9. She kept walking. At the end of the corridor, through the reinforced window of the side room, she could see Torres still crouched beside Rex's stretcher, notebook in hand, writing down the gum color reading with the focused seriousness of someone who understood that the small thing he was doing mattered. Rex's ears were up. That was new. That was better. Mara stood there for 3 seconds and let herself feel the particular quality of relief that came not from the crisis ending, but from the crisis yielding, from the moment when the numbers start moving in the right direction and the variables begin one by one to resolve. Then she turned and went back to work. She didn't know that in a conference room on the 4th floor, a call had already been placed to the hospital's board of directors. She didn't know that the name being spoken in that call was hers. She didn't know that by morning, the question of who Mara Voss was and what this hospital had done to her was going to have an answer that nobody in administration was going to be able to walk back. She just knew there were patients, and she knew how to help them. That had always been enough. She didn't know that by morning, the question of who Mara Voss was and what this hospital had done to her, was going to have an answer that nobody in administration was going to be able to walk back. The call from the fourth floor had been placed at 6:47 p.m. By 6:49, the board's emergency liaison had picked up. By 6:51, a name had been written on a notepad in a quiet office 12 blocks away, underlined twice, with a question mark beside it that would not stay a question mark for long. Mara knew none of this. She was in Bay 6, repacking a wound. The patient in Bay 6 was a petty officer named Aldrich, late 20s, built like someone who spent serious time in water, currently lying very still with the careful stillness of a person managing significant pain without wanting to show it. The field dressing on his left thigh had been applied correctly for battlefield conditions and incorrectly for a hospital setting, and whoever had done the secondary wrap in transit had used too much compression over the wrong quadrant, which was restricting circulation to the lower leg in a way that hadn't triggered the monitoring alarm yet but was going to. "This is going to feel worse before it feels better," Mara told him. "Does it help if I tell you I can't feel much anyway?" "Not really." She cut the outer wrap. "Means the nerve response is already compromised." Aldrich looked at the ceiling. "Great." She worked steadily, unwinding the compression layer, assessing the wound underneath, checking the color and temperature of the foot. The circulation wasn't gone. She had maybe a 15-minute window before that became a harder conversation. And she repacked with the correct pressure distribution, checked again, confirmed the color was returning. "You're going to keep the foot," she said. He exhaled. Just once. Short and controlled, the kind of exhale that carried a lot more than it looked like. "Thank you," he said. Quiet, direct, no performance in it. She tied off the dressing and moved on. The ER floor had found a rhythm by the 2-hour mark. Not a comfortable rhythm, nothing about 14 trauma patients was comfortable, but a functional one, the kind where each person knew their lane and was staying in it, and the handoffs between interventions were happening without the bottlenecks that had threatened to collapse the whole operation in the first 30 minutes. Mara had not eaten since 6 that morning. She registered this the way she registered most physical information during a sustained emergency. Noted, filed, not acted on yet. She'd had half a bottle of water somewhere around the 90-minute mark, and that was going to have to be enough for now. Dr. Petrov found her in the corridor between bays. Imaging came back on 3 of the blast patients, Petrov said, handing over a tablet. No preamble. They'd moved past preamble somewhere in the second hour. Mara looked at the scans. "Bay 2's worse than I thought." "I know. I've already called surgery." "And 7? "Consistent with what you said earlier, conservative management, monitoring overnight." Mara handed the tablet back. She was about to move toward Bay 11 when Petrov said her name. Not the professional placeholder version, just her name, the way Rourke had used it. "Mara." She stopped. Petrov had the expression of someone choosing words carefully, not out of dishonesty, out of something more like discomfort with what the honest words were going to cost her. "I've been here 11 years, Petrov said. "I've run trauma alerts, multi-vehicle, industrial, 2 building collapses." She paused. "I've never managed a floor the way you managed this floor tonight." Mara looked at her. "I'm not saying that to make you feel better," Petrov added. "I'm saying it because it's accurate, and I think accuracy matters right now." "It does," Mara agreed. Neither of them said anything else. There wasn't anything else that needed saying. Petrov turned back toward the surgical consult, and Mara went to Bay 11, and that was how respect worked sometimes. Not warm, not ceremonial, just true. Bats. Bay 11 held the case she'd been watching from a distance for the past 40 minutes. The patient was a Marine dog handler. She'd pieced that together from the unit markings on his gear bag, which someone had placed on the chair beside the bed. His name tape read OSEI. He was 26, maybe 27, and his presenting injury was a compound fracture of the left forearm that had been splinted correctly in the field. The fracture wasn't what was worrying her. What was worrying her was the way he kept asking about his dog. She'd heard it from the corridor twice. The same question, patient and then less patient, directed at whoever happened to be in the bay at the time. He'd been told both times that the K9 situation was being handled. He'd accepted that answer twice. He was running out of acceptance. When she came through the curtain, he looked at her directly. "Are you the one working on Rex?" he asked. "Rex is with the veterinary liaison," Mara said. "His vitals have been improving for the last 30 minutes. Imaging is pending, but the preliminary assessment is positive." Osei looked at her for a moment. "You know what you're talking about." "I've worked with military working dogs." "Where?" "Overseas, Army, different unit, similar work." He nodded slowly, the movement careful around whatever was happening with his pain levels. "Briggs," he said then, "my dog. They keep telling me the K9 situation is handled, but nobody's telling me anything about Briggs." Mara went still. "What does Briggs look like?" she asked. "Shepherd mix, black and tan. He's got a scar on his right ear from... What does it matter what he looks like? Where is he?" She'd assumed Rex was the only MWD in the incoming casualties. The radio report had mentioned one K9. But radio reports from active incidents were compressed and incomplete, and she should have known better than to treat them as comprehensive. "I'll find out," she said. "That's what the last two people said." "I know." She met his eyes. "I'm going to actually do it." She was back in the corridor in under a minute, moving toward the intake desk where the manifest from the military convoy should have been logged. It had been partially. The casualty list had been entered in arrival order, which meant it was organized by when each patient had come through the doors, not by unit or classification. She scanned it once, twice, looking for a secondary K9 notation. Nothing. She went to the charge nurse, a steady woman named Priya, who'd been managing the desk since the alert started and looked like she'd aged approximately 3 years in 2 hours. "The convoy manifest," Mara said. "Is this the complete list?" Priya looked at it. "It's what came in with the first vehicle. The third vehicle in the convoy was delayed. Mechanical issue on the access road. They offloaded separately maybe 20 minutes ago." She pointed toward the east corridor. "I think they went through the secondary entrance." Mara was already moving. The secondary entrance was technically the loading dock entrance, used for equipment delivery and, in mass casualty events, overflow intake. She pushed through the fire door and into the east corridor and found it. A second staging area, smaller, less organized than the main ER floor, where 3 patients from the delayed vehicle had been placed and were currently being assessed by a single overworked resident who was visibly in over his head. And in the corner, on a transport stretcher that had been wheeled against the wall and left there, was a black and tan shepherd mix with a scar on his right ear. The dog was conscious. That was something. But the way he was lying, completely flat, none of the alert tension that a healthy working dog maintained even at rest, told her enough before she even reached him. She crouched down. Did a rapid visual assessment. The dog's breathing was labored and asymmetric, the right side of his chest moving differently than the left. She pressed 2 fingers gently below the right scapula and felt what she was afraid she'd feel, the subtle crepitus of compromised tissue, air where air shouldn't be. She stood and found the resident. His name tag said Marsh, 2nd year, trauma rotation. "This dog has a pneumothorax," she said. "Right side. How long has he been in this corridor?" Marsh looked at the dog, back at her. I wasn't briefed on how long. 20 minutes, maybe 25. She pulled out her phone and called Kimura directly. The veterinary liaison picked up on the second ring. "I have a second MWD," Mara said. "East corridor staging, shepherd mix, suspected right-sided pneumothorax, 20-plus minutes without intervention. I need you here now." A pause. "I'm still with Rex. Rex is stable. This one isn't." Another pause, shorter. 2 minutes. Mara crouched back down beside the dog. She put her hand on his flank and felt the shallow, uneven effort of each breath. "Briggs," she said, quietly, testing it. The dog's eyes moved toward her, slow and exhausted, but they moved. "Okay," she said. "Okay. We've got you." She stayed there. She wasn't going to leave him in a corridor again. Kimura arrived in 90 seconds, not 2 minutes. She took one look at the dog and confirmed the assessment, and the next 10 minutes were focused and controlled and very close to the edge of the window where intervention would still make a difference. When Briggs's breathing began to even out, the specific change in the sound of it, the shift from labored asymmetry to something approaching normal rhythm, Mara became aware that her own hands were shaking slightly. She pressed them flat against her thighs for a moment. Let it pass. You found him in time, Kimura said. It wasn't a compliment so much as a statement of fact. He was 20 feet from the main intake and nobody flagged him. Kimura didn't respond to that directly. I'm going to need to set up a proper monitoring space for both dogs. This corridor is inadequate. I'll arrange it. She went back through the fire door into the main ER corridor and nearly walked directly into Dr. Whitfield. He was not alone this time. Beside him stood a man she didn't recognize, mid-50s, dressed in civilian clothes, but carrying himself with the particular posture of someone accustomed to being the most senior person in any given room. He had a visitor badge clipped to his lapel. It said, Board, Dawson M. She registered the name, filed it. Ms. Voss, Whitfield said. His voice had a quality she hadn't heard from him before, careful in a different way than his usual careful. Not procedural, not administrative. Something closer to uncertain. There are 2 military working dogs in this facility, Mara said, without slowing. I'm arranging monitoring space. I'll need a room adjacent to the main trauma bay, and I need someone to contact Ose in Bay 11 to tell him his dog is stable. Ms. Voss, it can wait until the dogs are situated. She looked at Dawson directly, just for a second, long enough to register that he was watching her with an expression she couldn't read and didn't have time to analyze. 2 minutes. She got the room arranged. She sent Garrett to Bay 11. She confirmed with Torres that Rex's vitals had held and that the imaging request had been submitted. Then she came back to the corridor where Whitfield and Dawson were waiting. Dawson spoke first. I'm told you were suspended this morning. Yes. And you came back anyway? Yes. He looked at the tracking board. At the patient status indicators, almost all of them moved from red to yellow or yellow to green over the course of the evening. At the notes logged against each intervention, times, assessments, redirections, a documentary record of how the floor had been managed. Who coordinated this response? He asked. The question hung there. Whitfield said nothing. He was looking at a point somewhere between Mara and the wall, and she understood, watching his face, that he was in the specific kind of discomfort that came from knowing an answer and not yet being ready to say it. A voice came from behind her. She did. Petrov. Standing at the entrance to the main bay, still in her trauma gloves, not pretending she hadn't been listening. Dr. Petrov? Dawson said. I'm the senior trauma attending on shift, Petrov said. I coordinated with Ms. Voss throughout the response. The triage restructuring, the identification of delayed presentation blast injuries, the secondary K9 patient, all of that came from her. She paused. I want that on record. The corridor was quiet. Mara looked at Whitfield. He finally met her eyes, and what she saw there wasn't the careful procedural man who had explained to her that morning that being right wasn't the point. What she saw was someone who was beginning to understand that there were things worse than being wrong. Things like being wrong in writing. In front of a witness. On the same day that the person you'd suspended had just managed the largest emergency response in the hospital's recent history. I'd like to understand, Dawson said, turning to Whitfield. What exactly happened this morning? Whitfield opened his mouth, closed it. The careful procedural language that he was so good at seemed to have temporarily left him. Mara didn't wait for it to come back. Mr. Dawson, she said, I correctly identified an internal hemorrhage in a post-surgical patient who would have gone home and bled. Dr. Whitfield suspended me for contradicting the attending physician's assessment. The patient collapsed 40 minutes later, imaging confirmed the hemorrhage, and the corrective procedure was completed successfully. She kept her voice level, factual, the way she'd learned to speak in Army debriefs, where what mattered was the sequence of events and the outcome, not the feelings wrapped around them. That's what happened. Dawson looked at her for a long moment. Then he looked at Whitfield, and the expression on his face, the specific quality of it, the way his jaw had set, told Mara something that she filed away carefully. This wasn't a man who'd come to the hospital tonight to manage optics. This was a man who'd come to understand something, and who was now understanding it faster than anyone had planned. I'd like the full patient file for this morning's incident on my desk by 8 a.m., Dawson said. To Whitfield, not to her. And I'd like a complete log of tonight's response timeline. He turned to Mara. Ms. Voss, I'd appreciate it if you were available to speak with me tomorrow morning. I'm suspended, she said, evenly. I'm aware. He held her gaze. I'm asking anyway. She looked at him. She looked at the tracking board. She looked at the corridor where, 20 feet away, Kimura was monitoring two military working dogs who were both, against reasonable odds, still breathing. 8 a.m., she said. She turned and went back to work. She was 3 steps away when a sound stopped her. Not an alarm, not a radio. Something quieter than that. It came from the direction of Rourke's room, a single, sharp knock on the interior window, the kind someone made when they couldn't get to a call button fast enough. She changed direction without thinking, pushed through the door. Rourke was not in the bed. He was on the floor beside it, one knee down, the IV line pulled partially from his arm, the monitoring leads dangling. He'd gotten that far, off the bed, to the floor, and then his body had apparently made its position known. "What are you doing?" she said. Not a question, more like an assessment. "I heard." He stopped. His breathing was effortful. "Someone said Briggs. I heard the name through the wall. Is that Osi's dog?" "He's stable. Kimura has him." Rourke closed his eyes briefly. "Osi's been in my unit for 2 years. That dog, I know." She was already crouching, checking the IV line, assessing where the lead had pulled from and whether anything had been damaged. "The dog is stable. Ose has been notified. Now I need you to work with me here." "I'm fine." "You're on the floor." "I've been in worse positions." "I know you have. Get back in the bed." He looked at her. The pain was visible now. He'd been managing it so carefully all evening that she'd almost forgotten how significant his injuries were, and the floor had apparently reminded him. "You're going to kill yourself trying to check on everyone else," she said. "Let me do my job." A long pause. "Yeah," he said, quietly. "Okay." She helped him up. He was heavier than he looked, which meant he was exactly as heavy as a SEAL should be, and the angle was awkward with the IV line, and neither of them made it graceful. But he got back into the bed, and she resecured the leads, and she checked the IV insertion point, still viable, minor bruising, and reset the drip. She was straightening the monitor when he spoke again. "Mara, accept the sedative this time." "In a second." He waited until she looked at him. "When you go to that meeting tomorrow morning." "I don't know what the meeting is yet." "When you go," he said again, like she hadn't spoken. "Don't let them make it about policy. Don't let them bury it in language about protocol and systems." She looked at him. "Make them say what it actually was," he said. "What they actually did." She held his gaze for a moment. Then she reached over, pressed the call button for the nurse, and said, "Tell them he's ready for the sedative." She was at the door when the monitor behind her made a sound that was not the usual steady rhythm it had been making. It was faster, irregular. She turned. Rourke's face had gone the wrong color. She was back at the bedside in 2 steps, already reaching for the call button again. Her eyes on the monitor, reading the pattern. Not the sedative, not the position change, something else. Something that the chest imaging from earlier hadn't caught, or had caught wrong. A rhythm disturbance that was only now becoming visible because his body had finally run out of reserves to compensate with. She hit the call button hard and said one word into the intercom. "Crash!" The monitor screamed. Not a flatline. Worse than a flatline in some ways, because a flatline was simple, and this wasn't simple. The rhythm on the screen was ventricular tachycardia, fast and disorganized. The heart doing something that looked like working but wasn't. The electrical system misfiring in a loop that would become fatal inside 3 minutes if it didn't convert. Mara had already pulled the crash cart from the wall before the first nurse came through the door. "VTAC," she said. "No pulse. Get me the defibrillator." Garrett was there in 4 seconds. Petrov was through the door in 7. Mara had already started compressions. Correct depth, correct rate, her weight behind each one the way it had to be, no hesitation. And she was counting in her head because counting out loud took breath she needed for thinking. "Charging," Petrov said, hands on the defibrillator. "Hold." Mara checked the rhythm, still VTAC. "Clear." She lifted her hands. The shock went through Rourke's body in a single visible contraction. And then she was back on compressions before the monitor had finished resolving. Because waiting for the monitor was how you lost the seconds that mattered. The rhythm on the screen flickered, reorganized. Then, slowly, unevenly, but unmistakably, sinus rhythm. She stopped compressions, put 2 fingers to Rourke's neck, pulse, weak and too fast but present. "We have him," she said. Nobody cheered. That wasn't what happened in real resuscitations. What happened was that the room's energy shifted from acute crisis to the next phase of acute crisis, and everyone started moving toward the next thing that needed doing. "He needs a cardiology consult right now," Mara said. "The chest imaging from intake either missed a contusion or he's thrown a rhythm disturbance from the rib fractures. Either way, he needs continuous monitoring and someone who specializes in traumatic cardiac events." She looked at Petrov. "Is Vargas on tonight?" "I'll call him. Tell him it's a SEAL with blast exposure and blunt chest trauma who just converted from VTAC. He'll want the full intake imaging and the rhythm strip from the last 10 minutes. Petrov was already on the phone. Mara stayed at the bedside. She watched the monitor. She watched Rourke's face, still pallid, still wrong, but breathing. And she kept her fingers loosely on his wrist, not because the monitor wasn't doing its job, but because some information only came through contact. His eyes opened, unfocused at first, then finding her. "That bad?" he asked. The words were thin. "Cardiac event. You're back in rhythm." He processed that. "Rex is still stable. So is Briggs. Stop asking about everyone else." A pause. Something moved in his face that wasn't quite a smile. "Old habit." "I know. Lie still." She stayed until Vargas arrived, a compact, efficient cardiologist who asked the right questions fast and ordered the right tests without being prompted, which was the most she ever asked of a consultant. She gave him the full picture, all of it, nothing softened, and stepped back to let him work. In the corridor, she leaned against the wall for a moment. Just a moment. Her shoulders ached. Her hands had stopped shaking, but they felt heavy in a specific way that came from sustained fine motor effort over several hours. She looked at the clock on the wall, 9:22 p.m. She had been back in this building for approximately 3.5 hours. She pushed off the wall and went back to the floor. The formal crisis had peaked. She could feel it in the ambient sound of the ER. Still busy, still elevated, but the acute edge had softened into the sustained monitoring phase, which was its own kind of demanding but ran on a different engine. The patients who were going to stabilize had stabilized. The ones in surgery were being handled by people whose specific expertise was exactly what those cases needed. The 2 MWDs were in the arranged monitoring room under Kimura's watch, both of their vitals holding. What remained was the paperwork. Not the hospital's paperwork. She was suspended. She had no standing to complete official documentation. But the mental paperwork that happened after a sustained emergency, the internal accounting of what had been done correctly and what hadn't, where the gaps in the response had been and why they existed. The secondary K9 case, Briggs, that had been a gap. Not her gap specifically, but a systemic one. The convoy's casualty manifest had been incomplete, the secondary entrance intake had been under-resourced, and nobody had a defined protocol for MWD triage in a mass casualty event involving military units. Those were 3 separate failures that had very nearly cost an animal his life and would have devastated Osi, who was going to carry the specific guilt of a handler whose dog was injured, regardless of how well Briggs recovered. She made a note of it, in her own handwriting, on a piece of paper she'd taken from the nurse's station, because she wasn't putting it in the hospital's system, and she wasn't going to remember everything accurately by morning. She was still writing when the east corridor door opened and Osei came through it. He was in a wheelchair. His fracture had been set and splinted, and there was no medical reason for him to be mobile, which meant someone had either helped him without authorization or he'd found a way to get himself into the chair alone. He was pushing with his good arm. His face had the concentrated expression of someone who had decided they were going to do something and had made their peace with whatever consequences came with it. "Bay 11 is the other direction," Mara said. "I know where Bay 11 is." He kept pushing. "Where's Briggs?" She looked at him for a moment, at the splint, at the IV line that was still in his right arm and definitely not attached to anything. "If I take you to him," she said, "you go back to Bay 11 after. No argument." "Deal." She walked beside the wheelchair. At the monitoring room door, she knocked twice. waited for Kimura's acknowledgement, and opened it. Briggs was in a proper kennel enclosure now, elevated off the floor, monitoring leads attached to his chest with the specific adhesive pads used for veterinary cardiac monitoring. His eyes were open. His breathing had evened out completely. When Osei's wheelchair came through the door, the dog's head came up. Not dramatically, not with the movie dog energy of a full recovery moment, just the slow, tired recognition of an animal registering the specific person it had been trained to work with. The scent, the sound, the presence, and deciding that the exhausting effort of lifting its head was worth it. Osei made a sound that he probably would have rather made in private. Mara stepped back toward the door and let him have the space. Kimura, standing at the monitoring station, said nothing, just continued watching the screen with the professional courtesy of someone who understood that some moments belonged to the patient and the person, and the clinician's job was to stay out of the way. Mara looked at Briggs's vitals on the secondary display. Steady, stable, everything moving in the right direction. She stepped out and closed the door quietly behind her. At 10:15 p.m., she found herself in the small break room adjacent to the main nursing station, sitting in a chair that she hadn't intended to sit in, having apparently sat in it without noticing. There was a paper cup of coffee on the table in front of her. She didn't remember making it. It was lukewarm, which suggested she'd made it some time ago and then set it down and walked away and now come back and sat in a chair near it more or less by accident. She drank it anyway. Priya came in 4 minutes later, poured herself a cup of something, and sat down across the table without making it a production. "How are you doing?" Priya asked. "Fine." Priya gave her a look that communicated clearly that this answer was being accepted under protest. "Your hands are shaking," Priya said. Mara looked at them. They were, slightly. Adrenaline clearance. "I know what it is." Priya drank her coffee. "I'm just saying, you did something significant tonight, and you're sitting here alone in the break room drinking cold coffee, and your hands are shaking, and someone should notice that." Mara looked at her. Priya shrugged. "I've been at this desk for 4 hours, I noticed." It wasn't a warm moment exactly, but it was a human one, and Mara, who had been operating on pure functional logic for the past several hours, felt it land somewhere in her chest with more impact than she'd expected. "Thank you," she said, meaning it. Priya nodded and finished her coffee and left without further comment, which was exactly the right thing to do, sat. The meeting with Dawson was at 8 a.m. She had approximately 10 hours. She needed to sleep for at least a portion of them, which meant leaving the hospital, which meant walking back to the parking structure, picking up the box she'd left on the concrete barrier, and driving home. She finished the cold coffee. She stood up. In the corridor outside the break room, she passed Whitfield. He'd been there for hours. She'd seen him at intervals throughout the evening, always at a slight remove from the action, watching. Not interfering after that first corridor confrontation, just watching. She'd registered it and filed it and focused on the floor because Whitfield's presence or absence didn't change what needed doing. Now, in the quieter corridor, he stopped when he saw her. She stopped because he was in her path and walking through him wasn't an option. "Ms. Voss," he said. She waited. He looked like someone who had been composing a sentence for several hours and had not yet found the version of it that satisfied him. "The Gerald Putt case," he said finally. "Your flag this morning." "Yes, you were correct." She held his gaze. "I know." Something moved in his face at that. Not offense, because she hadn't said it to wound him, just to be accurate. Whatever moved was more complicated than offense. She thought it might be something adjacent to grief, the specific kind that came from realizing you'd made a mistake that had consequences you couldn't take back. "I didn't dismiss your assessment because I thought you were wrong," he said. "I dismissed it because the system doesn't have a mechanism for a nurse being right when an attending says otherwise," Mara said. "I know. I've been working in this system for 7 years." He was quiet. "That's the problem, Dr. Whitfield," she said. "Not you specifically, the system. What it does to the information that comes from the people closest to the patients." She wasn't angry. She'd moved past angry somewhere around the 90-minute mark of managing his ER, with her suspended badge still sitting on a concrete barrier outside. "I'll see you at the 8 a.m. meeting." She walked to the elevator. She went down to the lobby. She went through the doors and across the pickup lane and into the parking structure, and she found her box exactly where she'd left it on the concrete barrier, undisturbed. The hand lotion, the photograph, the annotated medication guide. She picked it up. She stood there for a moment in the parking structure's yellow fluorescent light, listening to the October wind move through the open levels above her, and she let herself feel the full weight of the day. All of it, the suspension, and Gerald Putt, and the military convoy, and Rourke on the floor, and Briggs in the East Corridor, and the cold coffee, and Priya saying someone should notice. She let it exist. She didn't push it away, and she didn't fold under it. Then she carried the box to her car and drove home. She was back at Hargrove General at 7:45, not in scrubs this time. In the clothes she'd worn to her last Army debrief, dark slacks, a fitted jacket over a plain shirt, the specific civilian professional outfit she'd assembled years ago for situations where she needed to be taken seriously by people who judged by appearance. She'd learned that from her commanding officer, who had been a woman in her 50s with a voice like gravel and zero patience for the idea that competence should have to dress up to be heard, but who had also told Mara, once, that sometimes you wore the uniform that made the next conversation shorter. She had the handwritten notes from the previous night in her jacket pocket. The timeline of patient interventions, the specific sequence of decisions, the names and times and outcomes. She'd organized it at 5 a.m. after 2 hours of sleep that had not been particularly restful, but had been enough. Dawson's assistant met her in the lobby and took her to a conference room on the 4th floor. Not the boardroom, a working room, with a table that had been recently used and a whiteboard with partial notes from some other meeting still visible. Dawson was already there, and next to him, which she had not anticipated, was a woman in a Navy uniform, a commander by the insignia, and a man in civilian clothes who had the specific posture of someone attached to a legal function. Mara sat down. "Ms. Voss," Dawson said, "thank you for coming." "You asked." He acknowledged that with a slight nod. "I want to introduce Commander Hale, Naval Medical Command, liaison for the casualties transferred to Hargrove last night. And this is Warren Fitch, the hospital's legal counsel." He paused. "I asked them both to be here because what we're discussing this morning has implications in multiple directions." Mara looked at Hale. Hale looked back at her with an expression of professional assessment that Mara recognized, the kind of measuring look that military medical personnel gave each other in the first 30 seconds of meeting. "The Navy has already received a preliminary report on last night's response," Dawson said. "It includes specific commendation of your actions." She said nothing. "Commander Hale has additionally provided us with documentation of your service record," Dawson continued. "With your permission, she'll speak to that." Mara looked at Hale. "Go ahead." Hale opened a folder. "Staff Sergeant Mara Voss, 75th Medical Support Battalion, discharged honorably 6 years ago. 3 overseas deployments. Specialized training in combat casualty care and military working dog trauma management. 8 commendations, including a Bronze Star with Valor for actions during a 2019 extraction mission in which she sustained moderate injury while treating wounded personnel under fire." Hale looked up. "The Navy considers the personnel you treated last night to be under our protection. What happened to one of our patients in this facility yesterday morning, specifically the sequence of events that led to your suspension, is of direct interest to us." The room was quiet. Mara had not told anyone about the Bronze Star. It wasn't in any documentation she'd submitted to Hargrove General. She kept it in a shoebox on the top shelf of her closet with several other things she didn't look at often. "How did you get my service record?" she asked. "Lieutenant Commander Rourke requested it this morning," Hale said. "He's been awake since 6 a.m. Dr. Vargas is aware." Mara absorbed that. Of course Rourke had. Of course he'd been awake at 6 a.m. after a cardiac event, filing requests on her behalf. "I need to say something," Mara said. "To the room in general, but looking at Dawson. What I did last night, coming back, working the floor, I didn't do it to make a point about my suspension. I did it because there were patients." "I understand that," Dawson said. "I'm saying it because I don't want the conversation about what happened to me to become the whole conversation. There are system issues here. The Gerald Putt case isn't an isolated event. Nurses at this hospital have been raising clinical flags for years and having them dismissed." She put her handwritten notes on the table and slid them toward him. I wrote down what I could remember, but there are other nurses who can tell you more. Dawson looked at the notes. He didn't pick them up yet. He looked at them the way someone looked at something that confirmed what they'd already started to suspect. How long have you been aware of this pattern? He asked. Since my second year here. She paused. I stopped formally raising concerns after the third time documentation went nowhere. I kept doing my job instead. Fitch, the legal counsel, said, Ms. Voss, before we go further, I want to advise you that you have the right to have your own legal representation at this meeting. I'm aware. Do you want to pause and arrange that? No. She looked at the notes on the table. I want to keep talking. The door opened. She hadn't heard a knock. Neither, apparently, had Dawson, because he looked up with the expression of someone whose meeting had just been interrupted without permission. Whitfield came in. He was carrying a folder of his own. He looked like a man who had not slept, which was accurate, and he looked like a man who had spent the hours he hadn't slept making a decision, which she suspected was also accurate. I asked to be included, he said to Dawson. I know what it is. Whitfield sat down at the table. He put his folder in front of him and didn't open it immediately. He looked at Mara. I spoke to the nursing staff this morning, 6 of them, before this meeting. He paused. I've been at this hospital for 14 years. Nobody said anything. In 14 years, he said, I have dismissed a clinical flag raised by a nurse and been wrong about it. He stopped, seemed to be counting internally. More times than I can immediately account for. The room stayed quiet. I thought that was acceptable, he said. I thought that was part of managing a system. The acceptable error rate. The cost of maintaining functional hierarchy. He looked at his folder. It isn't acceptable. The Gerald Putt case isn't acceptable. What I did to Ms. Voss yesterday morning isn't acceptable. He finally opened the folder. I've written a formal statement to that effect. I want it entered into the investigation record. Mara looked at him for a long moment. She thought about the corridor conversation the previous evening, his unfinished sentences, the procedural composure coming loose at the edges. She'd read it then as the beginning of something. She hadn't known it would move this fast. Dawson looked at the statement. He looked at Whitfield. He looked at Mara. Ms. Voss, he said, I want to ask you something directly. Okay. What does this hospital need to do to make this right? It was a broader question than she'd expected. She'd come prepared for procedural conversation, the suspension, the review, the reinstatement pathway. She hadn't come prepared for that question, which was why she took a moment before answering, because that question deserved a real answer, not the first thing that came to her. Reinstate me, she said. Clear my record. But those are the easy things. She looked at the handwritten notes still on the table. The harder thing is building a mechanism, a real one, with teeth, for frontline clinical concerns to be documented and reviewed without going through the physician whose judgment is being questioned. Not because physicians are wrong, but because sometimes they are, and right now there's no safe pathway for that information to surface. That's a structural change, Fitch said. I know. It would require policy revision, potentially union consultation, board approval. I know, she said again. I'm not asking for it by tomorrow. I'm answering the question I was asked. Dawson had been writing something. He stopped writing. He looked at her with an expression that had lost, somewhere in the last 90 seconds, the careful neutrality of administrative assessment. I'm going to suspend Dr. Whitfield's authority over emergency triage decisions pending the full investigation, he said. Effective today, Dr. Petrov will assume interim leadership of the emergency department. He looked at Whitfield. That's not a punishment. It's a structural decision that needs to happen before any real change can be built. Whitfield nodded. He looked, if anything, like a man who'd expected something worse and was processing the specific relief of appropriate consequence. As for Ms. Voss, Dawson continued, the administrative suspension is lifted immediately. Full pay restoration, record cleared, formal written apology from the hospital to be delivered by end of week. Mara said nothing. And I'd like to have a separate conversation, Dawson said, about a more formal role in emergency preparedness. What you did last night with the mass casualty protocol, the restructuring, the secondary patient identification, that's not something you improvise. That's training and experience and judgment. We should be building on it, not routing around it. She looked at him. She was trying to find the catch, the administrative language underneath the offer, the version of this that sounded good now and quietly didn't happen later. She was used to looking for that. She didn't find it in his face. "I'll have the conversation," she said. Hale cleared her throat. Everyone looked at her. "Lieutenant Commander Rourke," Hale said, "asked me to deliver a message if this meeting went in the direction it's going." She looked at Mara. He said, "Tell her she was right." Mara looked at the table for a moment. "He was already right about that," she said. The meeting continued for another hour. Documents were reviewed, timelines confirmed, next steps outlined. Fitch took notes. Whitfield's statement was formally entered. Hale provided the Navy's official commendation for the mass casualty response, which would go into the hospital's record and Mara's personnel file both. By the time it concluded, Mara had been reinstated on paper. Walking out of the conference room, she felt the weight of it. Not relief exactly, because relief implied the danger was over, and she'd learned a long time ago that institutional change was slower than a single meeting, but something close to it. The specific quality of a situation that has been named correctly after a long time of being misnamed. She took the elevator down. She walked through the lobby toward the ER. She was passing the main nursing station when Priya looked up from the desk. "Heard the meeting went well," Priya said. "Word travels fast." "It's a hospital." Priya went back to her screen. "Also, Bay 4 is asking for you specifically. New patient, chest presentation. The resident flagged it, but he looks uncertain." Mara stopped walking. "I'm technically not on shift," she said. "I know," Priya said, not looking up. "Bay 4. Mara stood there for a second. Then she clipped her badge back to her chest. Her badge, which someone had retrieved from wherever Whitfield had put it and left on the nurse's station counter without comment, and turned toward the bay. She pushed the curtain open. Assessed. The patient in Bay 4 was a 61-year-old man with chest tightness and a presentation that the resident had correctly flagged as ambiguous. She looked at the monitor, looked at the patient, asked 2 questions. Then she turned to the resident, a young woman named Albright, who was watching her with the focused attention of someone trying to learn something. "What do you see?" Mara asked. Albright hesitated. "The troponin is borderline. I'm not sure if—" "Don't start with the labs," Mara said. "Start with him. Look at how he's sitting. Look at where the discomfort is localizing. Then tell me what you think." Albright looked, really looked, the way students did when someone told them to stop filtering through the chart and use their eyes. "He's guarding on the left," Albright said slowly, "and his color is, say it, off. His color is off." "That's right." Mara looked at the patient. "Sir, we're going to run some additional imaging. Can you tell me if the discomfort changes when you take a full breath?" The man tried. Something shifted in his expression. "Yes," he said. "It gets sharper." Mara nodded. She turned back to Albright. "Write up the imaging request," she said, "and flag this chart as priority. Don't wait for the repeat troponin." Albright was already moving toward the computer. Mara looked at the patient, at the monitor, at the numbers moving on the screen, steady for now, but telling her something that the numbers alone wouldn't fully explain for another 30 minutes. She had a formal roll offer pending. She had a cleared record and a reinstated badge and a meeting result that was better than she'd walked in expecting. And there was a patient in front of her who needed her to pay attention. The meeting could be processed later. The record could be processed later. Right now, there was this man, this room, this monitor. She pulled a stool to the bedside and sat down. "I'm going to stay while we wait for imaging," she told him, "just to keep an eye on things." He looked at her with the particular expression of a patient who had been alone and uncertain and was now neither. "Thank you," he said. She nodded, looked at the monitor. And outside the bay, in the corridor she couldn't see from where she sat, she didn't hear the sound of quick footsteps. 2 sets, urgent, coming from the direction of the cardiac monitoring unit, where Declan Rourke had been under observation since 6 a.m. She didn't hear the alarm that followed. She didn't hear Vargas's voice, sharp and immediate, issuing an order that meant only one thing. By the time the sound reached her, it was already almost too late. She heard it between one heartbeat and the next. The alarm from the cardiac unit had a specific pitch, Not the standard monitor tone that fired a dozen times a shift for leads that had slipped or patients who'd shifted position. This one was the sustained two-frequency alert that meant the monitoring system had detected something it couldn't resolve on its own. She knew that sound the way she knew her own name. She was on her feet before she'd consciously decided to move. "Stay still," she told the man in Bay 4. "Someone will be with you in 60 seconds. She was through the curtain and into the corridor already, moving fast, badge swinging against her chest, and she could see through the glass partition of the cardiac monitoring unit that Vargas was already at the bedside and two nurses were setting up equipment, and the rhythm on the wall monitor was doing something that made her push through the door without knocking. V-fib. Not V-tac like the previous night. Ventricular fibrillation. The heart's electrical system in complete chaos. No coordinated contraction, no output. The kind of rhythm that killed people in minutes if it didn't convert. Vargas was fast. She'd thought that about him the previous night, and it was confirmed now. He had the defibrillator charged before she'd fully cleared the doorway. Clear. The shock. The contraction. The 3 seconds that felt like 30 while the monitor resolved. Sinus rhythm. Unstable, but sinus. Vargas exhaled through his nose. "He's back." Mara looked at the monitor. At Rourke, who was unconscious now in the way people were unconscious after a major cardiac event. Not sleeping, not sedated, but the specific unresponsive stillness of a system that had just been through something it barely survived. His color was terrible. "Second event in 12 hours, she said. "I know." Vargas was already on the phone. "I'm calling for a transfer to the cardiac ICU. He can't stay on this floor." Agreed. She looked at the monitor. The rhythm was holding, fragile, but holding. "What's your read on the mechanism?" "Myocardial contusion from the rib fractures. The blast wave did more damage to the cardiac tissue than the initial imaging suggested." Vargas put the phone down briefly. "I missed it on the first read." He said it without covering it. Just stated it as a clinical fact, the way she'd stated facts the previous morning. And she recognized in that moment that Vargas was the kind of physician she could work with. "The initial imaging was taken under mass casualty conditions in a compressed timeline," she said. "You flagged him for continuous monitoring. That's why we have him." Vargas looked at her. "I'm not looking for absolution." "I'm not offering it. I'm stating what the record shows." He went back to the phone. She stayed at the bedside until the ICU transfer team arrived, watching the monitor, listening to the rhythm, doing the math on what 12 hours of myocardial contusion did to tissue that was already under stress from the rib injuries and the fragmentation wound and the blood loss from the initial trauma. When the transfer team came through the door, she gave them the full handoff. Every detail, in the correct sequence, nothing shortened. And then she stepped back and let them work. In the corridor outside, she stood still for a moment. The previous night, she'd told Rourke to let his body stop working so hard. His body had apparently taken the instruction too seriously. She went back to Bay 4. What? The imaging on the 61-year-old in Bay 4 came back 40 minutes later and confirmed what she'd seen in the way he was sitting and the way the discomfort sharpened with a full breath. Pericarditis, inflammation of the sac around the heart, not immediately life-threatening but requiring treatment and monitoring that the initial triage would have delayed by hours if Albright hadn't flagged it and Mara hadn't pushed for priority imaging. She walked Albright through the imaging results. Not performing instruction, actually walking through it, pointing at the specific indicators, explaining the clinical reasoning that connected the visual presentation to the imaging findings to the treatment decision. Albright took notes. Real ones, not the performative note-taking of a student trying to look engaged. The kind where the pen moved fast because the information was coming fast. "How did you know to push for imaging before the repeat troponin?" Albright asked. "The troponin tells you what's already happened," Mara said. "His presentation told me what was happening now. In an acute situation, now is more useful than already." Albright looked at her notes. "Is that something you learned in the Army?" "I learned it from a physician who told me the chart is a record of the past, and the patient is the present. He said if you're not sure which one to trust, trust the one that's still breathing in front of you." Albright wrote that down too. Mara left her with the patient and went to find coffee that was actually hot. Tit-tit. At 11:30, Dawson called her back to the 4th floor. Not the conference room this time. His actual office, which was smaller than she'd expected and significantly messier, with stacked files on every horizontal surface and a whiteboard covered in what appeared to be a multi-stage operational diagram that hadn't been updated in some time. It was the office of someone who spent very little time in it. He was on the phone when she arrived. He held up one finger. Wait, and finished the call in under a minute, which she noted because people who were important about their time usually couldn't end calls that fast. Sit down, he said. She sat. I've been going through the incident log from the last 3 years, he said, dropping a printed report on the desk between them. It was thick, flagged with color-coded tabs. Nursing staff concerns that were documented and then closed without action. Clinical flags that went into the system and were reviewed by the department head and marked resolved. He looked at the report. Do you know how many of those reviews were conducted by Whitfield? I'd estimate most of them. 83%. He sat back. He reviewed his own department's complaint record and cleared it. That's not policy violation. It's within his authority as department head, but it means 3 years of concerns from nursing staff were being evaluated by the same person the concerns were often about. Mara said nothing. This wasn't new information to her. It was just the first time she'd seen it stated numerically. I need to ask you something, Dawson said, and I need an honest answer, not a politic one. I'll do my best. How many nurses on this floor are afraid to raise clinical concerns because of what happened to you yesterday? She thought about that, about Priya at the desk, about Garrett in the corridor, about the way the staff had watched her yesterday evening, not with surprise that she was right, but with the specific expression of people watching someone do something they'd privately wanted to do for a long time. Most of them, she said. Dawson's jaw tightened. I'm going to need names, he said, not to put anyone in a difficult position, to build the investigation. People can speak confidentially, but I need to understand the scope of this. I'll talk to them, Mara said. They'll be more willing to come forward if they hear it from me than from administration. I'd appreciate that. She stood to go. One more thing, Dawson said. He opened a drawer and put something on the desk. A printed memo, Hargrove General letterhead, dated that morning. This is the formal notice of Whitfield's removal from department leadership. Interim, pending investigation. He looked at her. I want you to have a copy. Not because you need it legally, because I think you've earned knowing it exists. She looked at the memo, at Whitfield's name and the specific, precise language of formal administrative consequence. She picked it up, folded it, put it in her jacket pocket. Thank you, she said. She meant it differently than she'd meant it to Priya the previous night. This was something she hadn't known she needed until it was in her hand. She found Whitfield at 12:45 in the ER corridor where he was apparently still working, stripped of his leadership authority, but still present, still in the department, still doing the clinical work of an emergency physician, because patients still needed emergency physicians, and removing someone from administrative power didn't end their medical license. She hadn't planned to seek him out. She was walking toward the nursing station to speak to Priya about Dawson's request, and Whitfield was in the corridor, and there was a moment where they both registered each other's presence, and neither of them looked away. I've been spoken to by the board, he said. I know. I wanted you to hear from me directly. He stopped, restarted. I wrote that statement this morning, not because I was asked to, not because I knew the investigation was coming and wanted it on record. I wrote it because it was accurate. She looked at him. I understand if that doesn't matter much, he said. It matters, she said, not to my reinstatement, but it matters to whether anything actually changes here. She paused. Your statement is the thing that makes this an investigation instead of a personnel dispute. It's the difference between the board looking at one incident and looking at a pattern. He seemed to absorb that. The nursing staff, she said, when the investigation asks to speak with them, make it clear that participation is safe, not through an official memo. In person. Go to the floor and say it directly. He looked at her for a moment. You're telling me how to fix this. Someone has to. He didn't say anything to that, but he nodded, once, and not performatively. And she read in it the specific quality of someone who had arrived at accountability without being dragged all the way there, which was rarer than it should have been. She walked to the nursing station. By 2 p.m., she'd spoken to 4 nurses. Not formally. In hallways, in the break room, in the brief gaps between patient interactions that hospital floors ran on. She didn't ask them to come forward immediately. She told them the investigation was real, that Dawson was conducting it personally, that Whitfield had already submitted a statement acknowledging the pattern. She told them that speaking confidentially was an option. All four of them had something to say. Priya had 3 documented incidents spanning 2 years, all involving clinical flags that had been reviewed and closed without explanation. A nurse named Donovan had a written warning in his file from 18 months ago for what the documentation called insubordinate communication with attending physician. He'd raised a medication concern during a shift, and the attending had reported him instead of reviewing the concern. A nurse named Yi had simply stopped filing formal flags after the second one went nowhere and had been practicing a quiet, self-protective version of escalation that involved mentioning concerns in passing to whichever resident she assessed as most likely to listen. The fourth nurse, a traveling nurse named Brea, who'd been at Hargrove for 4 months, said something that stayed with Mara. "I worked at 3 hospitals before this one," Brea said in the break room, cup of coffee going cold between her hands. "At 2 of them, the dynamic was exactly like this. At the 3rd one, it wasn't." "And you know what was different about the 3rd one?" Mara waited. The nursing director there had been a floor nurse for 12 years before she went into administration. She hadn't forgotten what it felt like to flag something and be ignored. So she built a system where the flag went to 2 people simultaneously, the attending and a peer review board. Not to punish attendings, just so the information had another place to land if the first one didn't work. Mara looked at her. "Where was that hospital?" "Pennsylvania, small regional center, not fancy." Brea shrugged. "Better system than most of the big ones I've worked in." Mara wrote it down. Not for herself. For the meeting she was going to ask Dawson to schedule. Us. At 4 p.m., Commander Hale found her in the corridor outside the cardiac ICU, where Mara had stopped on her way to check the patient board. "Rourke's stable," Hale said. "Second event was a known risk given the contusion. Vargas has him sedated now, and the rhythm has been consistent for 3 hours." "Good. He's going to need 6 to 8 weeks before he can be cleared for anything physical." Hale paused. "He's already arguing about that timeline." "That's accurate to his character." Hale almost smiled. "He asked me to tell you something else." She looked at her phone, reading from a note. "He said, 'The box is still on the concrete barrier. You forgot to put it in your car.'" Mara stopped walking. She had. In the specific chaos of the parking structure and the military vehicles and the split-second decision to go back inside, she'd set the box down on the barrier, and she'd picked it up after her shift, she had. She'd carried it to her car. She was certain she had. "He's wrong," she said. "I took the box." He says he had eyes on the parking structure from his window at approximately 11 p.m. He says the box was on the barrier when he could still see clearly before the sedative kicked in. Mara thought back. She remembered picking up the box. She remembered the weight of it. She remembered sitting in the break room with the cold coffee. She remembered the walk to the elevator, the lobby, the parking structure. She did not clearly remember the box being in her hand. "I'll check my car," she said. She went to the parking structure at 4:15. Her car was on level 2 where she'd left it that morning. She checked the trunk, the back seat, the passenger seat. No box. She went back to the concrete barrier on the ground level. The box was there, where she'd left it the previous evening, sitting in the same position, apparently untouched for 18 hours. She stood and looked at it. Hand lotion, photograph, annotated medication guide. She picked it up. It was lighter than she remembered. It had always been lighter than it should have been, given what it contained. She stood in the parking structure for a moment with the box under her arm, listening to the building's ambient sounds. Wind through the open levels, the distant noise of the hospital, a car somewhere above her pulling out of a space. 7 years in a box that anyone could carry with one arm. She thought about Brea's hospital in Pennsylvania, about the peer review board and the 2-place flag system and the nursing director who hadn't forgotten. She thought about Albright writing things down in Bay 4 and Osei's hand finding Briggs's ear in the monitoring room. She thought about Rourke watching the parking structure from his window at 11 p.m. with a cardiac contusion and 2 broken ribs, keeping track of a box. She put the box in her trunk. She was closing the trunk when her phone rang. "Priya." "You need to come back up," Priya said. "What happened?" "Nothing medical." A pause. Dawson just called a staff meeting. Main conference room, 4th floor, 20 minutes. Another pause. He's asked all nursing staff, all attending physicians, and the board liaison to be present. He said it's regarding findings from the investigation. Mara looked at her phone. "I'm on my way," she said. She went back through the lobby. She took the elevator to 4. The conference room was filling when she arrived. Nurses she recognized and some she didn't. The attendings from the ER, Petrov, near the front with the focused expression of someone who'd been briefed. Whitfield in the back row, sitting apart from the physician group in a way that was either deliberate or unconsciously honest. She found a seat near the middle. Dawson came in at exactly 4:30. Hale came in behind him, and behind Hale came 2 people Mara didn't recognize, a man and a woman in civilian clothes, both carrying laptops, both with the specific purposeful energy of people who had flown somewhere quickly to be in a specific room. Dawson stood at the front and looked at the assembled room. "I'm going to be direct," he said. "What the investigation has uncovered in the last 8 hours is not a single incident. It is not a personnel matter that can be resolved through individual disciplinary action." He paused. "What we have found is a systemic pattern of clinical information suppression spanning at minimum 3 years, affecting an estimated 42 documented incidents, and touching the records of every nursing staff member in this room." The room was very quiet. "The board has voted to conduct an external investigation," Dawson continued. "The 2 individuals behind me are from a healthcare regulatory consulting firm engaged directly by the board, not by hospital administration. They will have access to all documentation, all personnel records, and all staff on a voluntary and confidential basis." Mara looked at Whitfield. He was looking at the table. "Effective today," Dawson said, "Dr. Whitfield is removed from all clinical leadership duties pending the outcome of the external review. That is not a suspension of his medical license. He remains a physician on this staff, but the department he led will operate under new interim leadership while the investigation proceeds." The room absorbed that. "I also want to say something that is not in the formal statement," Dawson said. He looked across the room and found Mara. "This investigation began because one nurse raised a clinical flag that was dismissed, was suspended for it, and came back anyway to do her job when the hospital needed her most. The investigation is not about her, but it would not exist without her." He looked back at the room. "That's not a compliment. That's an indictment of the fact that it took what it took." The room stayed quiet. In the back row, Whitfield closed his eyes briefly. In the middle of the room, Priya put her pen down on her notepad and looked at her hands. In the front, Petrov stared at the table with the expression of someone reorganizing their understanding of an institution they'd worked in for 11 years. Mara looked at Dawson, at the 2 external investigators with their laptops, at the printed packet being distributed by an assistant, the formal notice of investigation, the confidentiality protections, the timeline. She thought about Brea's hospital in Pennsylvania. She thought about what a real mechanism looked like, built into the floor of a system so deep that it couldn't be dismantled by a single department head's preference. She thought about what it would take to build that here. And then she thought about the 42 documented incidents in the report, and the ones that hadn't been documented because the nurses who'd witnessed them had learned quietly that documentation went nowhere, and she felt something that wasn't quite anger. Anger had a heat to it that this didn't have. This was cooler, more precise. This was the specific clarity of knowing exactly what needed to be done and having, for the first time in 7 years, a room full of people who were finally willing to hear it. Dawson was still talking. She was listening, taking notes. She didn't notice the door at the back of the conference room open. She didn't notice until a ripple of movement went through the back rows that someone had come in late. She turned. Graves. Dr. Elliot Graves, the attending who had dismissed her flag on Gerald Putt, who had documented her escalation and marked it as unsupported, who had not been present in the hospital since the previous morning, had not been part of the mass casualty response, had not been in the meeting with Dawson and Hale and Fitch. He was here now, standing just inside the door in his white coat, and his expression was the kind that people wore when they'd just been told something that didn't match the version of events they'd been carrying. He looked at Mara. She looked back at him. And in the printed packet on her lap, on page 3 of the incident documentation that the board's investigators had compiled in 8 hours, She saw a name she'd been waiting to see appear in formal writing since yesterday morning. Graves E. Gerald Putt case. Flag dismissed. Documentation reviewed. Outcome: patient collapsed. Internal hemorrhage confirmed. Emergency intervention required. Below it, in the clinical language of institutional accountability that had finally caught up to an event that had occurred less than 36 hours ago, was a single line that would not be removed from the record. Attending physician response classified as below standard of care. Graves stood in the doorway for 3 seconds too long. That was the thing Mara would remember later. Not his expression, not the white coat, not even the specific quality of the silence that had spread through the back rows when people recognized him. Just those 3 seconds. The gap between walking into a room and understanding what the room had already become without you. Dawson noticed him. The room noticed Dawson noticing him. "Dr. Graves?" Dawson said. Even. Professional. The voice of someone who had been expecting this arrival, if not precisely at this moment. "Please come in and take a seat. We're reviewing the investigation findings." Graves came in. He sat. He did not look at Mara again, which she understood. It was easier to manage a room if you didn't anchor yourself to the person in it, who most clearly represented the gap between what you'd believed about yourself and what the document said. Dawson continued. The 2 external investigators distributed the remaining packets. The timeline was presented, not dramatically, not as an indictment delivered from a podium, but as a sequence of documented events with dates and outcomes, the kind of accounting that was harder to argue with than any speech, because it didn't have a tone. It just had facts and what followed from them. Gerald Putt's case occupied 4 paragraphs. The attending response classification, below standard of care, was not the investigator's language. It was the language of the independent peer review board that Dawson had convened at 6 a.m. that morning, pulling in 3 external physicians through a process that Mara hadn't known was happening while she was walking to the parking structure and finding her box still on the concrete barrier. 6 a.m. He'd started at 6 a.m. She looked at Dawson at the front of the room and revised her read of him slightly. He wasn't just someone who'd asked the right question at the right time. He was someone who'd understood the previous night that the question had to be answered before the people who'd been wrong about it had time to prepare a better version of events. The packet was thorough. The pattern it documented was not the dramatic, obvious corruption of a system run by a villain who knew he was a villain. It was something more common and, in some ways, more damaging. A system run by people who believed they were maintaining order and had never seriously examined what the order was costing the people at the bottom of it. 42 incidents. 18 nurses named in the documentation, 7 of them still on staff. A recurring sequence: flag raised, flag reviewed by department leadership, flag closed without action. Nurse who raised flag either warned or quietly shifted to less favorable schedules. The scheduling data was in the appendix. Someone, she suspected Priya, had pulled it and sent it to the investigators at some point during the night. 3 nurses who'd filed multiple concerns in the same quarter had received schedule changes within 60 days. One of them had transferred to another facility 18 months ago. Her exit interview, filed and apparently never read by anyone in authority, said simply, "I don't believe my clinical judgment is respected here." Mara looked at that line and stayed with it for a moment. She'd felt that. She'd felt it for years and had managed it by focusing forward, by doing the work, by telling herself that the patients were the point and the institutional dysfunction was the weather, something you worked around because you couldn't change it. She told herself that was pragmatism. Sitting in this room with the exit interview on page 7 of an investigative report, she recognized it for what it had actually been: exhaustion. The specific kind that came from fighting the same wall for long enough that you started calling it a feature of the landscape. Graves left before the meeting ended. Not dramatically, not storming out. He simply stood up during a transition between sections, quietly excused himself with a word to the physician beside him, and walked out. The door didn't slam. His face, when Mara caught it for a moment as he passed the middle rows, was the face of someone doing a very controlled thing because the alternative was something less controlled. She didn't watch him go. There was more in the packet she needed to read. After the meeting, Dawson asked her to stay. The room emptied gradually, nurses in small groups, the quiet conversation of people processing something significant in real time. Whitfield left without speaking to anyone. Petrov stopped near the door and looked at Mara with an expression that communicated briefly and without words, something that might have been solidarity if that word hadn't been so overused that it had lost its texture. When the room was down to Mara, Dawson, and the two external investigators, Dawson put both hands flat on the table. Graves has requested a meeting with legal counsel, he said. This afternoon. His own legal counsel, not the hospital's. Mara absorbed that. The peer review board's classification stands independent of any action he takes, Dawson continued. It's in the record. It goes to the state medical board as part of standard reporting. He paused. I want you to know that this is not something the hospital can walk back or quietly resolve. The reporting is mandatory. I know the process, she said. I wanted to say it clearly anyway. He looked at her directly. This isn't going to be fast. Investigations like this run 6 to 9 months. There will be hearings. Some of them will be uncomfortable. He paused. For everyone, but particularly for the staff who come forward. They know that, she said. The ones who agreed to speak. Do they know it in the way that's real, not just in principle? She thought about Priya, who had 3 documented incidents, and the steady, unsentimental competence of someone who'd made peace with how much things cost. About Donovan, who had a warning in his file for caring enough to speak. About Yi, who had developed a workaround rather than give up entirely. They know, she said. They've been living with the real version of it for years. A formal process is actually easier than what they've been doing. Dawson nodded slowly. One of the investigators, the woman, was typing. The other was reading something on his phone. What do you need from me, Dawson said, to make your return to this department functional? Not just technically reinstated, actually functional. It was the 3rd time in 2 days he'd asked her a question that was larger than it appeared. She was starting to understand that this was how he operated. He asked wide and then stayed quiet long enough for a real answer to form. The peer review mechanism, she said. Like we discussed. I want to work on the proposal. Not alone. With a team that includes floor nurses, not just administration. She paused. And I want Albright assigned to my shifts for the next month. Dawson looked slightly surprised by the last one. The second-year resident? She knows how to look at the patient instead of the chart. That's harder to teach than people think. I don't want her to lose it because no one pays attention to it. He wrote it down. Done, he said. She found Graves at 5:40 in the physician lounge. She hadn't planned to. She'd gone to the lounge for the same reason she'd gone to the break room the previous night, the specific animal practicality of needing to sit somewhere that wasn't a corridor. He was there. He looked up when she came in, and something moved in his face that she read as the reflex of a person deciding whether to leave. He stayed. She poured coffee. She sat at the table 2 seats away from him, not close and not far, the distance of people who had something between them that hadn't been named yet. He spoke first. I didn't think you were wrong, he said. She looked at him. About Putt. I didn't think you were wrong, exactly. He was looking at his cup. I thought you might be right, and the probability was low enough that the cost of acting on it was higher than the cost of not acting on it. He paused. I ran a probability calculation in my head, and I got the numbers wrong. She held his gaze when he finally looked up. That's not a defense, he said. I know that's not a defense. No, she said. It isn't. I'm trying to say... He stopped. Started again. I didn't dismiss you because I thought nurses don't have valid clinical observations. I dismissed you because I was behind, and the path of least resistance was to let the chart override the flag. Another pause. That's also not a defense. What is it then? He thought about it. An explanation. I don't know if there's a difference. There is, she said. Defenses are for courts. Explanations are for understanding why the same thing keeps happening. She drank her coffee. The peer review classification is accurate. You know that. Yes. The process is going to be what it's going to be. I know. Then what do you want from this conversation? He was quiet for a moment. Not the evasive quiet of someone managing optics, but the genuine quiet of someone who wasn't sure of the answer. I don't know, he said finally. I think I wanted to say it to your face, that I knew, in the moment, that you might be right, and I chose the easier path. He looked at the table. I've been doing this for 16 years. I don't know how many times I chose the easier path, and was lucky enough that it didn't matter. That landed somewhere. She didn't soften it, and she didn't press on it. "Figure that out," she said. "Not for me. For the next one." She finished her coffee. She left him there. She didn't know what he did with what she'd said, and that wasn't her responsibility to track. She'd said the true thing. What happened to true things once they were in the world was up to the person who'd received them. 3 weeks later, the formal written apology from Hargrove General arrived in her email at 6:47 a.m. It was 2 pages. It named the Gerald Putt incident specifically. It named the suspension. It used language that legal had clearly negotiated into careful neutrality, but the core of it, the acknowledgement that her clinical assessment had been correct and that her suspension had been unjust, was there in writing, signed by Dawson and the board chair, and filed into her permanent personnel record. She read it once. She saved it. She closed her email and drove to work. The peer review proposal took 6 weeks to write. Not because it was complicated. The fundamental mechanism wasn't complicated. It was because doing it right meant talking to people who'd been hurt by the system they were proposing to fix, and those conversations took the time they took. You couldn't rush them. You couldn't extract the useful information from them and leave the rest on the floor. The useful information and the rest were connected. She met with Priya twice, Donovan once, Yi 3 times, because Yi had the most specific institutional knowledge of where the gaps were and was also the most cautious about whether a new mechanism would actually be used or would become another documentation exercise that went nowhere. "What makes you think this will be different?" Yi asked during the 3rd conversation in the break room, the same table where Mara had drunk the cold coffee on the night the military convoy came through. "Because the board is involved now in a way it wasn't before," Mara said, "and because the external investigators are going to be reviewing implementation at 6 and 12 months. It's not just a policy revision. It has external accountability." Yi looked at her. "And if it doesn't work? Then we document that it doesn't work and we come back to the table with the evidence." Mara paused. "That's the thing that was missing before. Not the policy. The evidence trail. Everything that happened before, every dismissed flag, every ignored concern, it existed, but it wasn't collected in a form that anyone could use. Now we build the collection into the mechanism from the beginning." Yi was quiet. "I'm not promising it'll be perfect," Mara said. "I'm promising it'll be documented." Yi looked at her coffee. "That's actually more useful." "I know." The proposal was submitted to Dawson on a Thursday. He read it over the weekend and sent back 2 questions. She answered them. The board reviewed it the following week and approved implementation with a 6-month pilot structure. Petrov, who had been running the emergency department as interim chief since Whitfield's removal, signed the operational endorsement without modification. Whitfield's formal review concluded 8 weeks after the staff meeting. The findings were specific and public within the hospital: sustained pattern of dismissing nursing clinical flags, inadequate peer review practices, scheduling actions that constituted indirect retaliation against staff who raised concerns. He was removed from all leadership positions permanently. His clinical privileges were retained. He remained a physician. He could still practice medicine, and Mara thought that was correct, because what he'd done was an institutional failure as much as a personal one, and stripping his license would have made him a clean villain in a story that wasn't clean. He was not at Hargrove General when the findings were released. He'd requested a leave of absence 2 weeks prior. She didn't know where he went and didn't ask. Graves's case moved through the state medical board process on its own separate track. At 8 weeks, he received a formal reprimand and a mandatory continuing education requirement in clinical communication and diagnostic humility. His privileges were not suspended. The reprimand was permanent and public. She heard that from Priya, who had the specific talent of knowing things that weren't officially announced yet. "How do you feel about it?" Priya asked. Mara thought about Gerald Putt, who had recovered completely and had sent a card to the nursing station that said, in handwriting that suggested a man who'd learned to slow down since his close call, that he was grateful to the nurse who wouldn't let it go. Priya had put the card on the bulletin board in the break room and nobody had taken it down. "I feel like the record is accurate now," Mara said. "That's what I wanted." Priya looked at her. "Just the record?" "The record is how it doesn't happen to the next person," Mara said. "That's more important than how I feel about it." Priya made a sound that communicated she found this answer both true and somewhat frustrating, which was also accurate to Mara's experience of the situation. Rourke was discharged from the cardiac ICU after 11 days. He spent 2 more weeks in general recovery before the Navy cleared him for transfer to a rehabilitation facility in another state. The morning he left, Mara was in the middle of a shift. He came to find her. In scrubs and a hospital-issue robe, moving carefully, the IV port still in his arm because the formal discharge paperwork hadn't been finalized yet, and he'd apparently decided that was a detail that could trail behind him. She was in Bay 4. Different patient, same bay, the hospital's geography indifferent to narrative symmetry. When she heard his voice in the corridor, she stepped out. He looked better than he had. Still pale around the edges, still moving with the careful deliberateness of someone whose body had recently staged a significant protest. But his eyes were the same, alert, watching, the specific quality of attention that she suspected was simply how he was wired. "You're not supposed to be walking around without staff," she said. "Garrett knows where I am." "Garrett is not a deterrent." "No," he agreed. "He's not." He stopped a few feet away. He looked at her badge, clipped to her chest, her name and department, reinstated and current. "I heard about the proposal, the peer review mechanism. News travels. I asked Hale to keep me updated." He paused. "She said it got approved. 6-month pilot, starting next month." He nodded, was quiet for a moment. She recognized the particular quality of this silence. He was saying something with it that he hadn't decided how to say in words yet. "When I was in the ICU," he said, "the first 2 days, when I wasn't fully conscious, I kept thinking about that extraction, Camp Verlaine, the rain." He looked at the middle distance. "I remembered you telling me Rex was coming, that you weren't leaving without him." She waited. "I think that's why I asked for your service record," he said. "Not to help you. I wanted to help you, but I think really I just needed to, I don't know that you were still that person, after everything this place had done." "I'm still that person," she said. I know that now." He met her eyes. "Rex is going to be fine. Full recovery. Kimura confirmed it last week. He'll be back on duty in 3 months. And Briggs? Briggs is already back at the kennel." A corner of his mouth moved. Osei tried to visit him every day during recovery. The kennel staff finally gave him a chair. She nodded, filed it, felt it. "Mara." Her name again, deliberate. "What you built here, the mechanism, the investigation, the record, that's going to outlast both of us in this building. That's the idea." "I know, He stopped, tried again. "Some people go through what you went through and they get smaller. They protect themselves. They stop fighting the wall because the wall's still there." He looked at her steadily. "You didn't do that." She held his gaze. "I almost did," she said. 7 years is a long time to fight something you can't see clearly. I almost called it pragmatism and let it go." She paused. "Gerald Putt is why I didn't. Not because I knew he'd collapse, because I looked at him and I knew what I was seeing, and I understood that if I accepted the version of events where I was wrong about that, I was accepting a version of myself I couldn't afford." Rourke was quiet for a moment. "Yeah," he said. "That's it. That's exactly it." Garrett appeared at the end of the corridor with the expression of a man who had been looking for a patient for the last 4 minutes and had found him and was choosing not to make it a confrontation. "Lieutenant Commander," Garrett said, "the discharge paperwork is ready." Rourke looked at Garrett, looked back at Mara. "Take care of this floor," he said. "I will." He turned and walked back toward the discharge area. She watched him for a moment. The careful gait, the shoulders that were still her job for another 30 seconds, and then someone else's entirely. And then she turned and went back into Bay 4. On the first day of the peer review pilot, Mara ran a 30-minute orientation session for the nursing staff. 12 people in the break room. She stood at the whiteboard and wrote 3 things: the mechanism, the timeline, the accountability structure. She did not give a speech. She explained a system. But at the end, before she erased the board, she said one thing that wasn't about the system. Every flag you raise, you're going to wonder if it matters. You're going to have days when it feels like you're putting something into a machine that grinds it up. That feeling is real, and it's based on experience, and I'm not going to tell you to ignore it. She looked at the room. At Priya, who had started this before any of them, and would likely outlast all of them. At Donovan, who had a warning in his file that the investigation had formally vacated last week. At Albright, who was technically a physician and technically not supposed to be at a nursing orientation, and was there anyway because Mara had told her to be. What I'll tell you is this: the flag is the record. The record is the protection, not just for the patient you're looking at right now, for every patient who comes after, and every nurse who raises the next flag, and the one after that. You're not doing this alone. You're doing it as part of something that's bigger than any single shift. She paused. That's it. Go to work. They went to work. She stood at the whiteboard for a moment after the room emptied, looking at the 3 things she'd written, and then she erased them because the whiteboard was a shared resource and other people needed it for other things. She walked out of the break room. She clipped her badge to her chest. She looked at the tracking board. 7 patients in the ER, 2 flagged for follow-up, 1 pending imaging. She went to the first patient. There were people who would tell you that the system was the problem and always would be, and they weren't wrong. There were people who would tell you that one person couldn't change an institution, and they weren't entirely wrong either. Both things were true. And also, Gerald Putt was alive. Rourke was in rehabilitation in another state, arguing with his physical therapist about the recovery timeline. Rex would be back on duty in 3 months. Briggs was already there. 42 incidents were in a formal record that couldn't be sealed. 12 nurses were running a pilot program that would either work or generate the evidence to make it work better. Albright was on shift in Bay 6, looking at the patient before the chart. The box was in her trunk. She'd never bothered to bring it back inside because she didn't need what was in it to do her job, and she'd never needed what was in it to know who she was. The badge was enough. The work was enough. The knowledge of what she'd seen and what she'd been right about and what she'd come back to even when she didn't have to. That was more than enough. It was everything. That's the thing they don't tell you about people like Mara Voss, the ones who get dismissed and pushed out and underestimated until the moment they can't be ignored anymore. They don't come back for recognition. They don't come back to prove a point. They come back because the patients are still there, and the work is still real, and somewhere in them is a part that was trained in places most people will never see to hold the line when everything else is failing. You don't manufacture that. You either have it or you don't. And when a system tries to take it from you, with paperwork, with suspensions, with the careful procedural language of people who've confused hierarchy with judgment, the remarkable ones don't let it. They set down the box. They walk back through the doors. They go to work.